Hi there, this is Allison with Let's Go Travel Tips. Today it's really exciting news. Just this afternoon, Princess announced their COVID health protocols for sailings from the United Kingdom. With this announcement, it is really clear that we are going to be waiting for another set of COVID health protocols for sailings taking place from Europe, as well as sailings taking place from Alaska. We are still waiting on that for this year. And so I wanted to start off by welcoming all of our Let's Go family members, and also welcome to all of you who are new. We are really glad to be here with all of you. We would love to invite any of you who haven't subscribed to please go ahead and subscribe to our channel. I think you will love being in our Let's Go family, and you will have the benefit of being able to stay up to date with all of the news that is constantly coming out lately with cruising. So first of all, Princess goes through and points out that these COVID health protocols apply to sailings on the Sky Princess from March 28th, from the Emerald Princess from May 1st, the Enchanted Princess from May 4th, and the Island Princess from June 29th. In order to sail on these cruises, it starts right off by saying that you have to be fully vaccinated, which means that you have received the final dose of your vaccine series at least 14 days before sailing. And they also say that boosters are not required at this point, but they are highly recommended, and that you are going to have to be tested before embarking the ship. So let me let everyone know which COVID vaccines are acceptable on these cruises. First of all, you can have the Pfizer, 2 doses of Pfizer, 2 doses of Moderna, 1 dose of the Johnson & Johnson, 2 doses of AstraZeneca, 2 doses of the Sinopharm, 2 doses of the Sinovac, 2 doses of the Covaxin, and 2 doses of the Novavax. Any of those vaccines are acceptable. Now, they do go ahead and point out what it takes to be considered fully vaccinated. It says for an individual to be considered fully vaccinated, at least 14 days must have passed since the administration of the last dose in their primary vaccine series. Some countries and regions also have a time limit for when the last dose was given, or have a booster requirement to be considered fully vaccinated. The U.S. CDC recommends a booster 5 months after you've had your mRNA COVID vaccine series, so that's either the Pfizer or the Moderna. Other countries and regions allow for up to 9 months or varying. Following the CDC guidance is sufficient to meet the requirements of most ports that we visit. Now, I know that when I was looking up the requirements to fly into Italy, because our cruise on May 28th departs from Rome, you either have to show a test before you come to their country if you're going to fly in, or you can be fully vaccinated. But the catch with Italy with the full vaccination is you can either show proof of full vaccination, your first vaccine doses, within 9 months, and if it's been longer than that, you need to have a booster to be considered fully vaccinated. So that's just my example of what they're trying to explain here. And as I have looked up the requirements for other places are having that same requirement, okay? Now, I want to point out that they say that it is the responsibility of their guests to make sure that they follow the vaccine policy. And part of what you have to do on that Medallion Class app, either on your phone or your device or on your computer with that system, is you have to attest that you are fully vaccinated. And so you also have to show proof of that vaccination as you board the ship. Now in the UK, let me tell you what they're requiring, because we do have UK travel, we do have UK Let's Go family members. And so it says, please note that the record card that is given out at the time of vaccination will not be accepted as proof of your vaccination status. Proof of vaccination can be a printed or digital format, a screenshot is fine, and must be an official certificate of vaccine status issued by your local health authority, for example, the National Health Service of England. It says to please visit your NHS or local health authority website for all of the details, and be sure that you do it at least 10 days in advance to 14 days in advance of when you're going to need it, as sometimes it takes longer to be able to get that document. And then it also says that you can also download a PDF copy of your vaccine record or request to receive an offline copy by email. Alternatively, to prove your vaccine status, you can show a screenshot of your vaccination details, which appear below your unique 2D barcode within the app. And they say that to point out that there is a page for each vaccine. So if you got 2 vaccines, there's a page for each one. And at the port, they are not going to be able to scan that 2D barcode. So make sure that you have got a screenshot of both shots, not just one, because they won't be able to pull the other one up. And it says, please register for the NHS app well in advance of travel, as the NHS app accounts can take up 14 days to approve. If using the app, in case of any connectivity issues, we would recommend taking a screenshot so that you can easily show this at the terminal. Now, last year in 2021 in August, when we went to Alaska from Seattle, there were some connectivity problems in that terminal. And so I just wanted to let you know about that. I love the screenshot idea, but really be sure that you're on top of it. Then they also say for different countries what they are willing to accept. So like I said, for England, it says they'll accept that digital or printed version of the actual NHS England COVID pass. For Wales, they will accept that same thing, the printed or soon to be available digital version of the NHS Wales COVID pass. For Scotland, they will accept the printed or digital version of the NHS Scotland vaccination status record. For Northern Ireland, they will accept the printed or digital version of the official Department of Health proof of vaccination document. From Jersey, England, they will accept Jersey's COVID status certificate distributed to all vaccinated islanders. In Guernsey, they will accept Guernsey's official proof of vaccination letter distributed to all vaccinated islanders. The Isle of Man, they will accept the digital or printed version of the NHS COVID-19 pass. And for all the people from Europe, we will accept the EU digital COVID certificate. And then for international and non-UK guests, it says the following formats are acceptable proof of full vaccination. Your digital or paper records. So that's what we have here in the United States. We have that vaccine card that they give us. Or some people have QR codes, so we can show those, showing the vaccine type, the date of each vaccine administered, the individual's name and date of birth, or other identifier. And so I'm sorry to make you have such a long list there, but that covers all of what will be accepted as far as proof of vaccine, because you don't want to accidentally get to the port and not have the right proof. It says on here, do I need COVID-19 boosters? And it says boosters may be required by certain health authorities on the itinerary or required on specific voyages. New vaccination entry requirements can change without notice, so we recommend that you keep your vaccination status up to date and ensure you are familiar with the requirements for the destination you plan to visit. So in the United States, just so that you are aware, the FDA and the CDC have said that you are eligible for a booster 5 months after you receive your Moderna or your Pfizer vaccine, and 2 months after you receive your Johnson & Johnson vaccine. And so make sure, is my suggestion if you really want to travel, that you stay up to date with those. I noticed in the news, I think it was 2 days ago, maybe it was on Tuesday, they had submitted for a second booster dose, and so we will wait to hear if that is approved and if it's going to become part of this. But I just wanted to let everyone know, stay up to date on that, and if we do hear that those are approved and that we need them, I will let you know. So it says, are they going to have any exemptions? It says, we manage the exemption process for a small number of guests who are ineligible for vaccines. subject to the regulations of the ports we visit. So I think that's their way of saying that in some ports, they're not going to allow any exemptions. So if you have one of these cruises booked, you're just going to have to check and see. I think if you've already been granted an exemption, you will hear from them if that is no longer able to, be valid. But I would think that you will be okay if you've already got that exemption. If you don't, you just have to call Princess directly and ask. And the number in the United States is 1-800-PRINCESS, and in the United Kingdom, it's 0344-338-8663. Okay, now they are still allowing children who are under 5 to sail, because children under 5 so far are not eligible for the vaccine. Now here's the next really big thing we all have been worrying about: testing, and we don't have to worry. So listen, to board the ship, you are going to have a COVID test to show. If you are fully vaccinated and don't have a booster, you can do the antigen test within 2 days and a PCR test within 3 days. And with Princess, they very specifically use the word days. They don't measure it by hours. And so if you're going to get on a ship on like a Sunday, and you are worried about the 3-day limit, you want to get that PCR test if you're fully vaccinated, you can get it on Thursday. So, because it's Thursday to Friday to Saturday to Sunday, so they consider that 3 days. But if you're boarding the ship at noon on Sunday, you can get the test at 9 a.m. on Thursday. So don't be worrying if you're a couple of days over the 72 hours, but make sure you're within the number of days, okay? The next update that they've got is that if you are complete, if you've got all of your vaccines, including your booster, you can do the antigen test within 3 days and the PCR test within 3 days. And if you're not fully vaccinated, you can do your PCR test within 3 days. Now, I think that this is wonderful. They do remind us before you leave home, do a COVID test. You don't want to fly out, get clear to the UK, ready to board a ship, and find out that you had COVID. But so they do still have that warning there. Now, I love this. It says for fully vaccinated guests. That means that you are fully vaccinated. It doesn't mean you have to have had the booster. We will offer antigen tests at the terminal that meet our requirements. For those that wish to take advantage of this convenience, a nominal fee will apply as a stateroom folio charge. I think that is terrific. So if you want to, if you are leaving home, you can do a COVID test and make sure that you don't have COVID and go and then just get tested right there at the ship. If you are just literally going to fly in, get there the night before, board the ship the next day, then you would have enough time for that 2 or 3 day window if you prefer to do it that way. But if you're going to come and stay a few days and then get on the ship, this is just fabulous. Or if you get there and your test results for some reason aren't with you, you have got a really nice backup plan. But I think that's absolutely wonderful. So let me tell you, and the kind of tests that you can do, like with the PCR and the antigen, are just like they have been here in the United States. They're just the ones that you normally get. The ones that, of course, that you have to have that healthcare provider on the other end of the line, the ones that we order like from Optum or eMed, and you can still do the ones that you get, at your CVS, your Walgreens, your health center, your Instacare. Those are all still acceptable. And let me tell you this also. It says if you're going to show up with your own COVID test, here's what you need to make sure is included in that information. You have to have where the test was administered, including information such as the name and contact information of the laboratory or healthcare professional who performed the test, the type of test, which it is, including it is an NAAT or antigen test, a specimen collection date 2 days or less before cruise departure, the guest's name and either the date of birth, age, or passport number, and a negative test results using words or containing the phrases negative, undetectable, SARS-CoV-2 RNA not detective, SARS-CoV-2 antigen not detective, COVID-19 not detected, or not reactive. And so depending on what kind you get, where you are, those are words that you need to make sure that show up. And as I read through those before I started this video, those are all very familiar. If you've had a COVID test done, you've seen those words. And so don't worry. I've seen those words on tests that I've had done at an Instacare before we went on our cruise in August, and I have seen them on the test results that we have gotten when we did the home test with the healthcare provider on the video call with us. So I wanted to let you know about that. So the next thing that I think is really important here for everybody to know is, let's see. As far as I know that we have got some Let's Go family members who have to use oxygen or dialysis, it says that they are able to welcome guests who use oxygen concentrators and guests who are undergoing peritoneal dialysis. Unfortunately, we are unable to accept guests who are dependent on supplemental oxygen tanks or who are undergoing hemodialysis at this time. And so I think that they feel like they've got limited resources right now with COVID going on. And so I wanted to make sure that everybody knows this. And here is another thing that we are not used to seeing all the time. As part of terms and conditions, it is mandatory for all UK guests to have suitable travel insurance to cover in order to cruise with Princess. Travel insurance enables our guests to relax and enjoy their holiday with peace of mind that they are covered for most eventualities. So it says this includes unforeseen incidences before the holiday, while traveling, or while they are away. Typical travel insurance covers cancellation of your holiday, stolen belongings, and medical treatment. Insurance documents will be checked at the terminal, and boarding will be denied at the guest's own expense if you don't have travel insurance. So that is really important. I know my husband and I always get travel insurance. We just always do. We did even before COVID, and now that we're post-COVID, kind of, as you maybe would call it, we make sure that we have even better travel insurance, just in case something unexpected, especially medical, happens, that we have got plenty of coverage on that. So I just want to make sure that everybody is aware of that for UK guests. It says for guests outside the UK, given the current global travel and health environment, all guests are strongly encouraged to purchase travel insurance prior to departure. And so just be really aware of that. So like I said, the UK guests are required, and everyone else is strongly recommended for that you have it. And so I'm going to make sure that we've got it on any of our traveling. So the next big thing people always want to know is about masking. So masking is going to remain like we have been seeing here in the United States recently on the cruise ships. It says masks on board will be recommended but not required in the vast majority of venues. There may be select venues or certain situations in which masks are required. This will be clearly designated with signage and onboard communications. And so don't worry, if you've got to wear a mask, they're going to let you know. They do remind everybody to please wear good quality masks. They suggest that that you wash it every day or have a new one for every day, just all of the basic things. And other, as I read through all these FAQs, like there's one like, can I still order room service, and all of these things. You know what, largely the onboard experience in cruising has not changed a lot. We have had a time when we had to wear masks all the time indoors. In the buffet, they are going to serve you rather than serve yourself, and I like that better anyway from the standpoint of everybody's not touching everything. I think that it cuts down not only on COVID is their goal there, but I think it cuts down on the transmission of a lot of other germs. And I've become much less shy about saying just a teeny bit, please, or yes, another spoonful, please. And so just kind of keep all of that in mind. Let's see, the next thing that I wanted to make sure that everybody knows, we always get the questions, people are worried about getting the test to fly back home again to their home country. Now, right now, today is Thursday, March 17th, and I do have another video today, and it's just this came out, and I think it's so important. So many people want to know that I'm doing a second video today, but people are really worried about having that test to go home, like I was saying. And in the United States, you still have to show a negative COVID test to come back to fly into the United States. And so Princess does say, it says if a negative COVID test is required for re-entry into your home country, subject to availability, Princess will cover the costs of any COVID-19 test administered on board within the time frame required to travel. Please note that if your travel plans go beyond the validity of an onboard test, you are responsible for securing and paying for your own test. And so as long as they are able to have those tests, Princess will do the test for us at disembarkation. I did look, and there is testing available at Heathrow. And so the London airport there, the main one, there's Gatwick also, but I just looked at Heathrow because that's what we always use. But I think that most airports now have testing, but I did double check and it is available there just in case something unexpected happens and Princess runs out of tests. They do have them there at the airport so that people can be tested before they fly home again. So this is what the COVID health protocols are in a nutshell. It seems like they are just going to require that test to get on board, the vaccination, and the travel insurance, and then we're going to be good to get on. The masking is going to stay like it has just been recently when they took away having to wear a mask all the time indoors, although if you want to wear a mask, you surely can. But I am really pleased that it is so straightforward, and I think it is very manageable, especially they're going to have that test available there right there at the port. That's going to be amazing. That takes a lot of worry out of it for everyone. And so if any of you have any questions about this, don't hesitate to put it in the comments below, and I'll do my best to find out for you. I really appreciate you watching. If you appreciate this video and appreciate my updates, would you please go ahead and give it a thumbs up? I really appreciate your help with that. I'll be talking to you all again really soon. You all take really good care. God bless you. Love you. Bye-bye.